Good afternoon. I'm Monica Ghaly, a research scientist with the California Department of Public Health, and I have been working on a study of insurance disparities along with Genevieve Kray, Kelly Wu, and Glorietta Kundetti. I will now present the results of this study titled Insurance Indicators in the California AIDS Drug Assistance Program to the Boston Congress of Public Health. Let's begin with the background. Insurance coverage is associated with viral suppression and better health outcomes for people living with HIV. The California AIDS Drug Assistance Program, ADAP, provides funding for life-saving medications along with insurance assistance and medical out-of-pocket benefits for eligible people living with HIV. Considering the insurance benefits offered by the program and the general benefit of having health insurance, there's program interest in navigating uninsured people living with HIV into comprehensive health insurance programs. Previous studies have explored the relationships between Spanish language preference, marital status, age, region of residence, and income with insurance status in the general population. With the goal of enhancing navigation efforts, this study utilizes two models which both aim to determine the utility of language preference, marital status, age, region of residence, viral suppression, gender, and income in identifying the clients most likely to be uninsured. Let's describe the methods. We built two models, a logistic regression model and a random forest model with insurance status, insured or uninsured, as the outcome. Language preference, marital status, age, region of residence, viral suppression, gender, and income are predictor variables. However, the two models do not have the same subcategories for the same variables. A comparison can be seen in Table 1. Language preference has 3 subcategories in the random forest, but only 2 in the logistic regression. Gender has 3 subcategories in the random forest and only 2 in the logistic regression. Both models serve the purpose of outlining the factors which indicate whether a client is more likely to be uninsured than insured. Because of Medicare eligibility age, we only included clients under the age of 65 who were active in the program as of October 2022. The logistic regression model uses all 19,358 clients to give the odds of being uninsured based on demographic factors. The random forest model, which is also a classification model, demonstrates a sampling schema applied to the training set that combats California ADAP's data imbalance to provide a more nuanced and accurate predictive model for insurance status. Now looking at Table 2. For the random forest model, insured clients were undersampled to be half as numerous as uninsured clients, and transgender women and clients with other language preferences were oversampled to be 30% and 50% of their respective variables dominant group in the training data. The adjusted sampling schema is not applied to the testing set. Now let's move on to the results. Table 3 shows the results in numerical form, and Figure 1 shows them graphically. Most of the results of the logistic regression model are well within expectations. Older clients, those with higher incomes, and those with a suppressed viral load are less likely to be uninsured when compared with younger clients, those with lower incomes, and those with unsuppressed viral load. However, younger clients ages 27 to 49 with a Spanish language preference are less likely to be uninsured. This is surprising when contrasted with the starkest result of the model, that clients with a Spanish language preference are 6.52 times more likely to be uninsured than insured. Residents of the Inland Empire or Southern California region, single clients, and clients between the ages of 58 and 64 with an FPL between 200 and less than 300% are also more likely to be uninsured than insured. Now looking at the figure, values on the left-hand side of the dotted line are less likely to be uninsured, while those on the right-hand side of the dotted line are more likely to be uninsured, with the dotted line at 1 being the cutoff point for significance. Significant values are identified in blue, and insignificant values are identified in red. Now let's look at the results of the random forest model. The results of the sampling schema I described can be seen in Tables 4 and 5, which are confusion matrices. metrics can be seen right below the tables. The effect of the adjusted sampling can be seen specifically in the priority metric, the recall rate. This metric measures the rate of clients correctly predicted to be uninsured. Since our goal is to use this model to correctly classify clients as uninsured in order to direct outreach, we are prioritizing correctly classifying the uninsured by maximizing the recall rate over correctly classifying the insured clients. Looking at the metrics below tables 4 and 5, we can see that the adjusted sampling schema has a recall rate of 73.5%, while the unadjusted sampling schema has a recall rate of only 61.1%. Let's discuss the implications. Models using California ADAP's enrollment system data are in line with results from similar studies and show that the following clients are more likely to be uninsured than insured. Those ages 18 to 26, those who have an FPL less than 100%, those who are between the ages of 58 and 64 with an FPL between 200 and less than 300%, or those living in Southern California or the Inland Empire, those who are single, and those whose language preference is Spanish are more likely to be uninsured than insured. The random forest model also provides insight into which variables should be balanced in order to maximize metrics of interest. These results may inform further outreach efforts to communities within the ADAP population to ensure that they have the support they need to attain comprehensive healthcare coverage. Finally, the conclusion. Further investigation is required to identify the specific barriers that those whose preferred language is Spanish face in the health insurance system. Perhaps more granular linguistic variables would more easily identify the drivers for this clear disparity. Future studies may also retain the different public and private insurance types to identify which ADAP clients tend to choose each type to facilitate navigation into insurance. Thank you very much. This concludes the presentation.